Hello, is it my voice is audible to you? Yes, so it's fine. Hello, good morning,
Morning.
Chandana.
Good morning, sir.
Chandana, are you gone through the clinical investigation plan?
Yes, sir.
Okay, good. Hello, good morning, dear students. My voice is audible to you?
Good morning, sir. Good morning.
Good morning. Now the time is 11:30. Let's wait 1 or 2 minutes. Let the remaining people will be joined.
Okay, sir. Okay, sir.
Okay, students, we'll start the session. The remaining will people will join in. Okay, and good morning, all of you.
Good morning, sir.
Good morning, thank you. And today's session is the continuation of today's session. So that is the clinical investigation of medical devices. So for clinical investigation of medical devices, yesterday we are seeing the two standards. One is as per European standard, and another one is the globally accepted standard, that is ISO 14155, right? So
Yes, sir.
yes, in today's session, I'm going to explain the what is this ISO 14155, particularly related to clinical investigation of medical devices, and what is the structure. What is the structure that is related to this clinical investigation? What is the outline? It can be mentioned in the this standard. I will give you in brief. Okay. Please let confirm whether my screen is visible to you or not.
Visible, sir.
Yes, yes, thank you. So, just a recall of yesterday's session, not in detail, superficial, just a one definition. What is a clinical investigation? So, how many member you remembered the definition, clinical investigation? Just go through the definition again. A clinical investigation is defined as any systematic investigation or study in or on one or more human subjects undertaken to assess the safety and or performance of medical devices. See, so it is a systematic investigation that can be undertaken in one or more human subjects for the purpose of to assess the safety and performance of a medical devices. See, that is a clinical investigation, but the same definition for clinical trial I already explained. In case of performance, it is in case of clinical trials. In case of performance, what is the word here? Hello.
Performance.
In case of clinical trials,
Clinical trials efficiency, sir.
yes, right. Safety and efficiency, not efficiency, efficacy. Safety and efficacy of a that particular pharmaceutical that can be a clinical trial. Here it is a performance. That is the only difference. And now coming to this today's topic, clinical ISO 14155. So it can be really the latest version is 2011. See, how many people you know? How do you pronounce a ISO? You people, everyone, you know the how you can pronounce that ISO standard. Yes,
Sir, today you said sir, first
yes,
two numbers should be pronounced combinedly as 14 and last three numbers should be pronounced like 155.
yes, right, very good. So it's a 14155, right? Is a 2011 is the what is the 2011? What it indicates?
Year. Updation of the year.
Yes, so it is the what is when that is the latest it is updated that year that can be here mentioned 2011. So the last update for this 14155 is the 2011. As a pharmaceutical regulatory professional, you should remember not only a ISO standard and also the latest amendment or latest update and year you have also remember. Let us say, I will give one example. మీరు ఒక మెడికల్ డివైస్ కి స్టడ్ తయారు చేస్తున్నారు, దట్ ఈస్ ఎ టెక్నికల్ డాక్యుమెంట్ తయారు చేస్తున్నారు టు సబ్మిట్ యూరోపియన్ కంట్రీ. సో బై యూజింగ్ ఏ వన్ స్టాండర్డ్, ఆ స్టాండర్డ్ యాక్చువల్లీ 2020లో లేటెస్ట్గా అప్డేట్ అయ్యింది, బట్ యూ కెన్ బి రిటర్న్ యాజ్ ఏ 2016 రాశారు. Actual standard is updated what is 2020. So the body, that is the European regulator body, is it accepted that version? Hello, are you able to clear my are you able to clear to understand my question?
Sure.
ఇఫ్ యాజ్ ఏ రెగ్యులేటరీ ప్రొఫెషనల్, మీరు రెగ్యులేటరీ ప్రొఫెషనల్లో ఒక జాబ్లో జాయిన్ అయిన తర్వాత మీరు ఒక మెడికల్ డివైస్కి టెక్నికల్ డాక్యుమెంట్ సబ్మిట్ చేస్తున్నారు. ఆ టెక్నికల్ డాక్యుమెంట్లో మీరు ఒక పర్టికులర్ ఐఎస్ఓ స్టాండర్డ్ అప్డేట్ 2020 యాక్చువల్గా, కానీ మీరు 2016 రాశారు, ఓల్డ్ వర్షన్ పెట్టారు. సో అట్లా అట్లా ఓల్డ్ వర్షన్ ఐఎస్ఓ వర్షన్ పెట్టి మీరు సబ్మిట్ చేసినప్పుడు రెగ్యులేటరీ అథారిటీ బాడీస్ మీరు సబ్మిట్ చేసిన ఐఎస్ఓ స్టాండర్డ్ని అప్రూవ్ చేస్తాయా చేయవా అనేది నా క్వశ్చన్. కెన్ యూ
మనం 2020లో సబ్మిట్ చేసిన అంటే రూల్స్ అండ్ రెగ్యులేషన్స్ అప్డేట్ అవ్వకపోతే 2016 అనే పెడితే గనక అవ్వచ్చు సార్. అప్పుడు అనేవి అప్డేట్ అవ్వకపోతే 2020లో సబ్మిట్ చేసిన 2016 రెగ్యులేటరీ బాడీ యాక్సెప్ట్ చేసింది కదా సార్. లేటెస్ట్ రూల్స్ 2016 అయితే కనుక.
అదే నేను చెప్తుంది, యువర్ సబ్మిటెడ్ యువర్ స్టడ్ ఇన్ 2020, మీరు 2020లో సబ్మిట్ చేశారు, బట్ స్టాండర్డ్ యూ రిటర్న్ యాజ్ 2016. దెన్ బాడీ ఈజ్ అప్రూవ్డ్ యువర్ అప్లికేషన్ ఆర్ నాట్? కెన్ యూ రిమైనింగ్ పీపుల్ అన్మ్యూట్ అండ్ ఆన్సర్? జస్ట్ యూ ట్రై according to your common sense.
Sir, if the rules are same, if there is no update means they will approve.
Okay, then remaining people, can you share your views? Okay, I will tell you. So if you are written 2016, that means a old version మీరు 2016 రాశారు, బట్ సబ్మిట్ చేసిన అప్లికేషన్ ఏమో 2020లో సబ్మిట్ చేశారు. సో అలాంటప్పుడు కంపల్సరీగా రెగ్యులేటరీ అథారిటీస్ మీ అప్లికేషన్ యాక్సెప్ట్ చేయు. సో యూ హ్యావ్ ఆల్సో మెన్షన్ that particular ISO standard. If that can be released any update in 2020, you should also mention that particular latest year also. Let us say here ISO 14155 2011 అని ఇప్పుడు మనం చెప్పాం. రేపు మీరు జాబ్లో జాయిన్ అయిన తర్వాత ఒకవేళ 2020 అప్డేట్ వచ్చింది అనుకోండి, ఇక్కడ కంపల్సరీగా 2020 అప్డేట్ పెట్టి మీరు సబ్మిట్ చేయాలి, రైట్? అదర్వైజ్ ద బాడీస్ doesn't accept that old versions. Rules and standards also same, but versions also you have to mention correctly. Is it clear?
Yes sir.
Yes. So here you see the name ISO 14155. It is the clinical investigation of medical devices for human subjects. So it is a part of GCP. What is GCP? A good clinical practice. How do you define a good clinical practice? What is the meaning of a good clinical practice? So we will see the definition of a GCP. A GCP, that is a good clinical practice, is an international ethical and scientific quality standard for designing, conducting, recording, and reporting trials that involve the participation of human subjects. So what is that? What is the standard or anything? What is the design you are created that is according to the only those guidelines only that can be internationally accepted one? Those design and conducting and recording and reporting, everything that involve the according to the quality procedures, that is called as a good clinical practice. So this documentation of clinical investigation of medical device is a part of GCP. So in order to compliance with this standard provides public assurance that the rights, safety, and the well-being of trial subjects are protected, consistent with the principles that have their origin in the Declaration of Helsinki, and that the clinical trial data are credible, right? So what is the what is this concept of Declaration of Helsinki? Can you people have any idea why this this terminology, this concept they should mention in this ISO Declaration of Helsinki? What this told? Sarika, you have any idea? Declaration of Helsinki? Chandana?
డ్రగ్స్ అనేవి మిస్యూజ్ అవుతున్నప్పుడు అవి సిస్టమాటిక్ గా యూజ్ అవ్వాలి అని చెప్పి ఒక యాక్ట్ అనేది తీసుకొచ్చారు కదా సార్. అంటే బెల్మాట్ యాక్ట్, న్యూరంబర్గ్ కోడ్ అవన్నీ డిస్కవర్ చేసినప్పుడు డిక్లరేషన్ ఆఫ్ ఫెలెన్సీ అంటే ఈ యాక్ట్ ప్రకారం క్లినికల్ ట్రయల్స్ అన్ని జరిగాకే డ్రగ్ అనేది మనం రిలీజ్ చేయాలి, అప్పుడే సిస్టమాటిక్ వేలో యూజ్ అవుతాయి అని ఈ యాక్ట్ చెప్తుంది సార్ మనకి.
సార్ హ్యూమన్ ఎథిక్స్ అంటే హ్యూమన్ రీసెర్చ్ క్లినికల్ ట్రయల్స్ హ్యూమన్స్ మీద చేసినప్పుడు ఎథిక్స్ కూడా ఫాలో అవ్వాలి అని చెప్పి.
Yes, that is the concept. So what is the trials you are conducted on humans, you have to follow the ethics. That is the declaration of Helsinki. You have to give the due respect to the those volunteers, and you have to follow all the ethical principles for the those who are involved in this trials. So that is the declaration of Helsinki. Right. So because here it is a clinical investigation, you have to give a due respect to the volunteers. That is the declaration of Helsinki. Okay, see, I leave it. When coming to the history of this ISO 14155, there will be a small history regarding the versions. The first version of this ISO 14155 that can be released in 1996. And it, again, that revision in 2003, part 1 and part 2. In 2009, only revision to the annexes. In 2011, harmonized with ICH, GCP, and the other global guidelines. So that is the latest version, 2011. And the next update version, we don't know when it can be happened based upon the requirement. So that's why I'm here. It is kept as a cross 2012. So one is also over. Here I want to put to 22 actually. Right. So what is the structure of this ISO 14155 2011? So what are the different outlines? What are the different headings that can be the structure this clinical investigation of a medical device? So it having a 9 important topics for this ISO 14155. First one is a scope. Second one is a normative references. Third one, terms and definitions. Fourth one, ethical consideration. Fifth one, clinical investigation planning. Sixth one, clinical investigation conduct. Seventh one, suspension, termination, and close out of the clinical investigation. Eighth one, responsibilities of the sponsor. Ninth one, responsibilities of the principal investigator. All these are the 9 topics that are discussed in the ISO 14155. That means they given the starting from the scope. So what is the scope? You have to why you have to perform that clinical investigation. Then second one, normative references. That means what are the different references you are followed for conducting of this clinical investigation. All the references and standards we have to give. And the terms and definitions. That is, what are the different terms you are used in the clinical investigation. All the terms are before you have to give the definitions. Fourth one, ethical considerations. What are the ethical principles we have followed for those volunteers? That is, we have to give explanation. And the clinical investigation plan. So every plan is required before conducting. So you give the plan. That is the clinical investigation plan. And finally, sixth one, clinical investigation conduct. How we can conduct? And it gives the narration. Seventh one, suspension, termination, and close out of the clinical investigation. If any of the unavoidable situation, how you can suspend, how we can terminate, how we can close the clinical investigation, that is also outlined under some chapter. In the 8th chapter, what is the responsibilities of a sponsor? And the 9th chapter explains the responsibilities of the principal investigator. All these are the different 9 chapters that is forms the structure of ISO 14155 2011. Now we'll see the one by one. So this is the structure. Apart from the structure, this ISO 14155 is also having the annexes. There will be a different annexes are there from A to F. We'll see the those annexes also. Annex A, it is a clinical investigation plan. So that means what is the plan that can be used in the form of a template. So in the form of Annex A. Annex B, investigator's brochure. Annex C, case report form. Annex D, clinical investigation report. Annex E, essential clinical investigation documents. And Annex F, adverse event categorization. All these are the different annexes that can be given along with the structure. Now we'll see the these 9 chapters in brief, not in detail, only in brief for your understanding. Already in the last class we discussed the how do you conduct this clinical investigation, what are the ethical principles. So what are the statistical considerations we have to take in, and what is the report, and all those major points are covered. Just for your future purpose only, I am mentioning this ISO 14155 in detail. So the first one, scope. So what is the scope of this ISO 14155? The name itself, we have to conduct the clinical investigation of medical devices as a part of GCP. So you have to take care of those volunteers. So that is the scope. So second, third is normal. It's a references, means what are the different references under different standards you are used during the conduct of a clinical trial. We have mentioned, and what are the different terms? What are technical terms? That is like what is a clinical investigation? What is clinical evaluation plan? So those technical terms we have to you must define. That is the third chapter, and the fourth chapter is ethical consideration. Now we will see the fourth chapter. Are you able to follow?
Yes, sir.
Yes, sir.
Yes, sir.
So this fourth chapter, ethical considerations, so it's having it is again subdivided into four sub chapters. Sorry, seven sub chapters. We'll see the first one is the 4.1 in general. So in general means what is the ethical considerations? So that concept can be explained here. Clinical investigation shall be conducted in accordance with the ethical principles that have their origin in the Declaration of Helsinki. What the Chandana told, that is the Declaration of Helsinki. So that is according to the ethical principles only we have to conduct this clinical investigation. These principles protect the rights, safety, and well-being of human subjects, which are most important consideration and shall prevail over interest of science and society. These principles shall be understood, observed, and applied to every step in the clinical investigation. Then 4.2, improper influence or inducement. 4.3, compensation and additional health care. 4.4, responsibilities. 4.5, communication with the ethics committee. 4.6, vulnerable populations. 4.7, informed consent. All these are the different subtopics and sub-chapters that comes under ethical considerations. So each and every one is a very, very important that have to followed by the sponsor. That is improper influence. 4.2, or inducement. So what are the other unavoidable situations and unethical practice they are not supposed to follow? Everything that can be explained in 4.2. And compensation and additional healthcare. If the volunteer, human volunteer is participated in the clinical investigation, what we have to compensate, and what is the additional support of healthcare you provided, that can be explained. And 4.4, responsibilities of a volunteer. 4.5, communication with the ethics committee. Those are must be communicate and explain those problems to the ethical committee, institutional review board. And 4.6, vulnerable populations. So what are the situations they what unavoidable situations they are faced? They must be explained. 4.7, all these must be that can be undertaken through a informed consent. So with the proper informed consent, that is every detailed procedure must be before the conducting of a clinical investigation. The sponsor must explain the pros and cons to the human volunteer, so that he must take a signature from him or her, so that then only proceed to the investigation. That is called as an informed consent. So all these concepts that can be explained under chapter 4. Then coming to the chapter 5. So it is a chapter 5 is a clinical investigation planning. So it's this chapter is again divided into 11 sub chapters. So we'll see that those 11 chapters outline. 5.1 is general. All parties participating in the conduct of the clinical investigation shall be qualified by education, training, or experience to perform their tasks, and this shall be documented appropriately. See, all parties, that means those who are involved in this conducting of a clinical investigation must be all of the educated one only. So a properly trained, because the sponsors are the investigator, everything those must be trained or experienced to perform these tasks. So that is the 5.1. And 5.2 is the risk evaluation. Before you can conducting a clinical investigation, you have to evaluate a possible risk that can be explained under risk evaluation. Then 5.3, justification for the design of the clinical investigation. You have to give the justification why you have designed this clinical investigation. I am explaining in the last class why you have undertaken for clinical investigation. మీరు ఎందుకు క్లినికల్ ఇన్వెస్టిగేషన్ చేయాలనుకుంటున్నారు, దానికి జస్టిఫికేషన్ నేను చెప్పాను. మీకు అది గుర్తుందా? జస్ట్ అన్మ్యూట్ అండ్ ట్రై టు ఆన్సర్. Mohini, are you able to recollect anything from the last class? Monica? Say something, yes or no. Are you able to hear my voice? Sunandini, are you there in the last class?
Sir. No, sir.
Unnara leda?
Ninna class absent, sir.
Okay, fine. Okay, okay. So I will explain again. This that is please mute. Yes, justification for the design of the clinical investigation. That means if that a proper this clinical investigation is a part of clinical evaluation. I already told. In clinical evaluation, if you don't get any information regarding to the safety and performance, then you can go for the clinical investigation. That is the main case. Then if it is a class 3 and it is an implantable device and it is a very new one and new to the market, and so you must be undertake this clinical investigation. That is such certifications, such justifications you have to give under chapter 3. And 5.4, this is the clinical investigation plan, SIP. And 5.5, investigators brochure. 5.6, case report form. 5.7, monitoring plan. 5.8, investigation site selection, agreements, labeling, data monitoring committee. So all these are the different different subchapters under the. Sir, good morning, sir. Dr. M.R.K. Garu. Sir, we are unable to hear your voice, sir. Dear students, are you able to hear the voice of Dr. M.R.K.?
No, sir. Sir is in mute, sir.
Sir, mute, sir.
Now you are able to hear?
Yes, sir. Yes, sir. Good morning, sir.
Good morning, Dr. Ramaya. Because this is under mute, that's why I just cleared it. Now you are able to hear. Thank you very much for inviting me.
Yes, sir. Thank you, sir.
I could understand how our students are able to follow you.
Yes, sir. Sir.
After end of the lecture, we will have a little discussion about all these things.
Sure, sir. Sure.
Okay. Thank you.
Yeah, sure. So this chapter 5, that is the clinical investigation plan. According to this ISO 14155, you have to give all the 11 chapters. That is starting from a general and a risk evaluation. That is what are the possible risks for that clinical investigation. We have to give over under chapter 5.2. And 5.3, justification for the design of the clinical investigation. So why you have to conduct the clinical investigation? You have to give you a proper justification. That is, if you don't get a proper clinical evaluation results, then you can go for the clinical evaluation. And if it is a class 3 and it also implantable device and it is very new, then you can go for a clinical investigation. Such justifications you have to give in under the chapter 5.3. And 5.4 is a clinical investigation plan. So without a plan, it is very impossible to conduct the procedure. So we have to design that clinical investigation plan according to the structure of ISO 14155. So then investigators brochures, a case report form, a monitoring plan, investigator site selection, agreements, labeling, data monitoring committee. All these are the different parts of this clinical investigation plan. So we have to follow the structure of ISO 14155 for the clinical investigation plan. So that is also your experiment number 22. You can follow this structure for your experiment also, while you are written under your treatment. Then coming to the 6th chapter of this ISO 14155, this clinical investigation conduct. How we can conduct this clinical investigation? This is also part of this ISO 14155. It explains how we can conduct this clinical investigation. It's again, this can be divided into 11 subchapters. It includes 6.1 general explanation, 6.2 investigate site initiation, investigation site monitoring, 6.4 adverse events and device deficiencies, 6.5 clinical investigation documents and documentation, 6.6 additional members of the investigation site team, 6.7 subject privacy and confidentiality of data, 6.8 document and data control, 6.9 investigational device accountability, 6.10 accounting for subjects, and 6.11 auditing. These are the different chapters you have to follow while conducting. That means what are the, after giving the justification why you are conducting the clinical investigation, you have to explain everything. What is the site you are taking, where you are going to conduct this clinical investigation, who is going to monitor the site, that is the 6.3 investigation site monitoring. So what are the possible adverse events and the device deficiencies you have to report, and 6.5 clinical investigation documents and documentation. So what are the reports we have obtained? Everything should be documented. And 6.6 additional members of the investigation site team. So who are the other members those are involved to monitor this investigation? That is also you have documented. And subject privacy and confidentiality of data. So what are the clinical data that is obtained? That privacy, that subject privacy is also very, very important. You have to everything that is the patient confidentiality, the patient name confidentiality is very, very important. You have to save the name in the form of a short names, not in detail, to maintain the subject privacy. And also the document and data control, investigation device accountability, accounting for the subjects, and auditing. All these are the different concepts under clinical investigation conduct. And the 7th one, suspension of this clinical investigation of medical devices. This chapter explains the suspension, termination, and close out of the clinical investigation plan. So what are the different circumstances where this clinical investigation going to suspend or terminate or close out this clinical investigation? So what are the possible when a patient may face difficulties during the clinical investigation? You have to suspend, or any if they are not following the declaration Helsinki principles, the government may give. It means the institutional review board may doesn't approve this your investigation and suspend. And if the clinical investigation report and documentation retention, everything you have to follow for this chapter. And chapter 8 explains the responsibilities of the sponsor. So who is the sponsor? A sponsor is a person who supports for conducting the clinical investigation. So here it explains the responsibilities of those sponsors. That is, it again divided into 4 subchapters. One is a clinical quality assurance and quality control, clinical investigation planning and conduct, outsourcing of duties and functions, communication with the regulatory authorities. So all these are the different subchapters coming under the responsibilities of the sponsor. So here this chapter explains completely what are the different roles and responsibilities of the sponsor that can be explained. This part of ISO 14155. And the last one, responsibility of the principal investigator. So this last chapter of ISO 14155 gives the narration about the responsibilities of the principal investigator. So what are the qualifications? So who is the person responsible for the conducting of this clinical investigation? Everything should be mentioned in the responsibilities of the principal investigator, like qualification of the principal investigator, qualification of the investigation site, communication with the EC, informed consent process, compliance with the SIP. Compliance with SIP means, so what is the plan we are already prepared, clinical investigation plan. The procedure also must comply. and 9.7 medical care of subjects, safety reporting. All these are the different responsibilities of a investigator must follow while conducting a clinical investigation of any medical device. So all these 9 chapters are the part of ISO 14155. So you should follow this ISO 14155 2011 for conducting of clinical investigation of medical devices as a part of GCP. GCP means a good clinical practice. So this is one of the important standard. So apart from this standard, you also follow this European government MedDev 2.7 revision 4. So medical device 2.7 revision 4. This is also the one of the guidelines document given by the European government for the conducting of a clinical investigation. These are the two ultimate guidelines for conducting a clinical investigation on medical devices. So that is today's topic. If you have anything, you should ask. Dr. Amarke Garu. Hello, Radhakrishna Garu.
Hello, I'm able to hear.
Yes, sir. Yes, sir. So this lesson is in continuation of the yesterday lesson, sir.
Okay, fine.
So this clinical investigation of medical devices. So here I'm trying to explain what are the guidelines to conduct the clinical investigation of medical devices. There will be two guidelines, sir.
Okay.
One is a MedDev 2.7 revision 4. It is a European guideline that can be accepted by the worldwide for conducting of a clinical investigation of medical devices. So another is the ISO standard, sir. ISO 14155. It is latest version is the 2011. This is another standard to follow the clinical investigation of medical devices as a part of GCP. So whether the sponsor or a investigator, you should follow these two standards for the conducting of a clinical investigation of medical devices. Whether the class, whatever the class it is.
Okay, Dr. Ramaya. The thing is, whether all your students are able to follow what you are telling about the terminology as well as the subject, the text subject.
Yes,
because so many students are just silent except one or two answering. I would like to ask the question to the students.
yes,
Are you able to follow?
students.
Yes.
You can
Yes,
unmute, answer.
Yes, sir.
Students, please answer.
Yes, sir.
Yes, sir. We are able
we
to
are
follow.
sir.
You're able to follow all the students?
Yes, sir.
Yes, sir.
Because so much, because I feel there's so much of content in subject. Only tabular forms are being shown. Every line is having its own expansion about text.
Yes, yes.
That's what I mean to say.
Yes.
Dr. Ramaya is trying to explain about every line, and all of you must be able to imbibe everything, whatever that is said. Are you able to follow?
Yes, sir.
Yes,
Okay.
Yes, sir, we are following.
Actually,
Dr. Ramaya.
actually, those subchapters are explained in the last class, sir. Okay.
No, you are told about nine parameters.
Yes, sir.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Yes, sir.
And in every parameter, you are again subdivided into about 5, 6, something like that.
Subchapters, yes, sir.
So it is going to, you see, every line of every subdivision
Yes, sir.
is a big thing to be thought of.
Yes, yes.
What I felt about this is, of course, I'm a novice and I'm not able to follow so fast as the students are able to, for the brains are so sharp, I could understand. And thing is, about the subject,
Sir.
about each line, the text underlying about each line of every parameter.
Sir, sorry to interrupt you, sir. The time is less than 1 minute. It's going to end, sir. I will connect you again, sir.
Okay, fine.
I will send the invitation again. Students, please join.
Okay, sir.